I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at WCANA, and I want to welcome each and every one of you to the Doctor's Edition. This is an opportunity for you to invite your healthcare professional in your life, be it a physician, a nurse, a chiropractor, a dentist. We are actively looking for some veterinarians because we want to offer CBD products for our pets, for our dogs and our cats. So this is an opportunity, yes, for your healthcare professional to hear directly from another healthcare professional. So we'll get started. This call or this Zoom webinar is every Tuesday at 7 p.m. Central Standard Time. And just a little bit about myself. I'm Dr. Rita McGuire. I'm an OB-GYN of 30 years. I cannot even believe it. It's been 30 years. I attended Wayne State School of Medicine. That's in Detroit, Michigan. I completed my residency at Cook County right here in Chicago. I am CEO of two of my own businesses, RJM Wellness and Rita Fitness. I'm also a global women's health and wellness speaker. I am a certifying physician for the medical marijuana program that we have here in Illinois. In fact, I was one of the very first physicians in Illinois to certify a patient for our opioid exchange program. That's a great program for those who want to utilize cannabis instead of their opioids. I'm a member for Doctors for Cannabis Regulation, and I'm one of the co-founders and the Chief Medical Officer for WCANA for Life. I want to introduce to you our Medical Advisory Board. This is a board that's made up of healthcare professionals that advocate for the use of CBD for their patients, for themselves and their community. This Medical Advisory Board is made up of physicians, MDs, PhDs, registered nurses, nurse practitioners, pharmacists, clinical psychologists, therapists, did I say chiropractors? And chiropractors. So again, what are we missing? We are missing those veterinarians. I would love for any of you on the line to refer some veterinarians on this call and direct them to me. So when we talk about really how cannabis became mainstream, we cannot leave out this colleague of mine, Dr. Sanjay Gupta. I'm sure you all know Dr. Sanjay Gupta. But what you may not know about him is that in 2009, I think it was, he stated that he absolutely saw no medicinal benefits in the use of cannabis. But it wasn't until Dr. Sanjay Gupta traveled the world when he started to interview scientists in other countries, when he started to interview patients, not only in other countries, but right here in the United States, is when he had to come out and make a public apology. He said that we have been systematically misled about this plant. He said, as a physician, I didn't dig deep enough. I didn't look far enough. I didn't study papers that had been buried by many pharmaceutical companies. And in 2013, 2014, when he made this public apology, this is when this plant became mainstream. This is when many of our patients started to inquire about how cannabis could improve their health. They started to inquire how cannabis could improve their blood pressure, their blood sugar, their pain, their anxiety, their insomnia, their inability to lose weight. I mean, patients wanted to know everything about this plant. So what we do know is that when cannabis became mainstream, One of the top pharmaceutical companies, GW Pharmaceutical, they paid attention. And they paid attention so much so that they developed the only FDA-approved CBD prescription called Epidolax. Epidolax is a prescription drug that is used for children who have epilepsy, that have seizure disorders. In fact, one of the little girls that was interviewed when Dr. Sanjay Gupta traveled the world in the United States, her name is Charlotte Fiji. It was this little girl whose parents took charge of her health. See, this little girl was having over 300 seizures a week. And it wasn't until her parents introduced her not to Epidolax, right? Not to this medication that costs $3,200 a month, but when her parents introduced her to Charlotte's Web, when her parents introduced her to a CBD product, her seizures went from 300 a week to 2 to 3 a week. So yes, this is the only FDA-approved medication, a CBD-approved medication called Epidolax, and yes, it is used for children that have Lennox-Gastaut syndrome, Dravet syndrome, like Charlotte Fiji had, and tuberous sclerosis. But this medication is not very attainable for the average child. This medication is $3,200 a month. So I'm excited to present information tonight about products, about an opportunity for all of us to gain improved health with CBD. So let's look at the difference between hemp versus marijuana, because when we speak about the cannabis plant, it's important that you understand that there's two species. One species is marijuana, which many of us may know about. It gives you the high, it gives you the euphoria, it gives you the paranoia. And then there's hemp. That's the other species that does not give you a high or a paranoia. What hemp does, it gives you the health without the high. And the way it's able to do that is because, unlike marijuana, hemp has a very small amount of THC. See, THC is the compound that is found in the cannabis plant that gives you the high. So hemp having 0.3% or less of THC and larger amounts of CBD, we're going to talk about what CBD is, it does not give you a high. So the hemp, by definition, is classified as a cannabis plant that contains less than 0.3% of THC. So the next question you may have as a healthcare professional, is CBD legal? And when the 2018 Farm Bill was passed, this allowed for CBD that's sourced from the hemp species containing less than 0.3% of THC to be legally cultivated, sold, and consumed in all 50 states. Now, there are some states that have not read the federal memo, but most states allow CBD to be cultivated, sold, and consumed. So again, when we look at the difference between marijuana and hemp, I can't stress this enough because many of you may still wonder, will our products get you high? And the answer is no. Our products will not get you high. Our products won't even get your patients high if you're a healthcare professional, because hemp contains very, very small amounts of THC. And hemp is legal in the United States. So the characteristics are similar, meaning both marijuana and hemp do contain CBD and THC, but the difference is in the amount of CBD and THC. So with that being said, If you live in Chicago or you live in Illinois and you go to a dispensary, many and most of their products that are marketed as CBD are sourced from the marijuana species. So that product will make you high because it has upwards to 10–20% of THC. So hopefully that's clear, the difference between marijuana and hemp, and hopefully you understand that hemp will not get you high. So CBD, or cannabidiol, is the #1 compound that you're going to find in the hemp species. It has many, many benefits. CBD helps to reduce bacterial infections. It inhibits cancer cell growth. That's why you're seeing so many oncologists, cancer physicians, using CBD in their practice. It's neuroprotective. It's helping to protect nerves that have been damaged, nerves that can be damaged after one has had a stroke, or nerves that are damaged in those who have dementia, or nerves that have been damaged in those who may have had trauma to their head or trauma to any part of their body that can damage a nerve. So that's why you're seeing a lot of neurologists using CBD. CBD promotes bone growth. You're seeing a lot of orthopedic surgeons utilizing CBD in their patients that have had fractures. CBD, again, reduces seizures and convulsions. Again, neurologists are utilizing CBD in their patients because it helps with seizures, it helps with epilepsy, and it helps as a neuroprotective. CBD reduces blood sugar levels. You're seeing family practitioners and internists and endocrinologists using CBD for their patients who have type 1 and type 2 diabetes. CBD reduces the immune function. It helps to balance the immune function. So you're seeing rheumatologists using CBD in their patients who have lupus or fibromyalgia or multiple sclerosis. CBD reduces inflammation. CBD also reduces arterial blockage. So we're seeing cardiologists using CBD in their patients who have blockage of the arteries in the heart. They have high cholesterol. CBD reduces small intestinal contractions. You're seeing gastrointestinal physicians, GI doctors using CBD in their patients who have ulcerative colitis and Crohn's disease. CBD reduces nausea and vomiting. CBD relieves pain. CBD relieves anxiety. You're seeing so many psychiatrists and psychologists and clinical psychologists using CBD to assist their patients who have anxiety, depression, and even schizophrenia. CBD slows bacterial growth. It suppresses muscle spasms. We're seeing a lot of patients getting relief that may have multiple sclerosis. And CBD is tranquilizing. It really does relax you and promotes an overall calmness. It treats psoriasis. We're seeing dermatologists using CBD topically, dermatologists using CBD as tinctures to really assist with those clients and patients that have eczema, that have acne, and have psoriasis as well. And then CBD is vasorelaxant, meaning CBD is able to dilate blood vessels, improve blood flow to major organs and glands. So you can see CBD, cannabidiol, does a lot. But there's other cannabinoids that the plant makes that I want you to know about and be aware of, like CBC and CBG and CBN and Delta 8 THC and Delta 9 THC. All of these cannabinoids that the plant makes synergistically works on a cellular level to put our body in balance. And we'll talk more about the endocannabinoid system in a second. But not only does the plant produce these amazing, incredible cannabinoids, but your body does too. Yes, your body produces cannabinoids just like the plant does. They're called endogenous or endocannabinoids. So endocannabinoids actually will mimic CBD and THC. So for instance, anandamide, which is an endocannabinoid, it really mimics the benefits and the result like THC. It is deemed the endogenous cannabinoid of bliss. In fact, it comes from a Sanskrit word, ananda, which means joy. It means bliss. It means calmness. In fact, anandamide is found in high levels of breast milk. Yeah, so those breastfed babies, I bet you were wondering why when you or have known someone to breastfeed, those babies are healthier. They're stronger, they're happier, they sleep better. Yep, it's because of these endogenous cannabinoids. And then there's 2-AG. Now, 2-AG is analogous to CBD. So anandamide to THC and 2-AG to CBD. So 2-AG gives more of the body response, helping to reduce inflammation, helping to assist with pain. So these two endogenous cannabinoids are both found in high levels of breast milk. They're found in beer hops. They're found in dark chocolate. So that's why when you consume a lot of these things, you feel better, you feel happier, you feel calmer. So many folks out here, including me, I'm not on any medication, thank God. But so many of my patients, maybe you're on the line, you're on a lot of medications, and you just want your physician to know that there is absolutely another tool in the toolbox that you can utilize. Not to replace your medication, because we always want to say, refer to your healthcare professional before you stop any medication. But just know that CBD is another tool that could be right there in your medicine cabinet to assist with a lot of challenges that you may have. So these are some of the top reasons that patients, folks, are using CBD for relaxation, for stress and anxiety relief, to improve sleep, to relieve muscle pain, to relieve chronic pain, to relieve joint pain. How many of you out there have joint pain, muscle pain? Put it right there in the chat. How many of you have difficulty sleeping or may be under a lot of stress? Put it in the chat what you're challenged with. Some reasons that folks use CBD is for social use, or maybe to treat migraines or offset nausea, or you want to use it to improve your skin. Or maybe you're out there and you're still menstruating to help with your menstrual cramps. There are even those out there that utilize CBD for sexual enhancement and even to treat seizures. So put in the chat what you're challenged with, if you feel comfortable with it, but just know these are some of the top reasons that folks are using CBD. And then when we look at the demographics, when we look at the age, when we look at the region of folks using CBD, the baby boomers, yes, are utilizing CBD the most, though we have an increase in millennials, in generational Z and X and J and all those, right? But just know across every region and across every age group, folks are utilizing CBD products. Now, I know you're wondering, how does CBD work? Because that's one of the very first questions I asked Melissa Boston, who is our CEO of Wakana. How does this work? I want to know. And especially if you're on the line as a healthcare professional, you absolutely want to know the science. Well, the science behind how CBD works and all of the cannabinoids, how cannabis works, let's just put it like that, how the plant works in the body, is through the human endocannabinoid system. Now, what's so great about the endocannabinoid system is that, yes, every human being has one, and every vertebrate has one. So your dog has one, your cat has one, your pets have one. That's why we're looking for a veterinarian, because we really want to offer our pets a high quality CBD product. But the human endocannabinoid system is fascinating. In fact, it was discovered when I was in medical school in the early 1990s. I'm dating myself, that's okay. But in the early 90s, a scientist from Israel, Raphael Mechoulam, discovered that there are receptors throughout our entire body. Every major organ, from our brain and central nervous system all the way down to our toe, our heart, our lungs, our liver, our kidney, our skin, our stomach, our teeth, our reproductive organs, every single organ and gland has receptors that's looking for cannabis. So when you consume cannabis, these receptors bind to the cannabis, CBD, THC, all of these cannabinoids, and they send a signal to the area that is out of balance. To put it in simple terms, that's how the endocannabinoid system works. It's a very vital physiological system that puts our body back in balance when we consume cannabis. And what's so fascinating about this system is that there are two main receptors, CB1 and CB2. Now, there are hundreds of receptors, but that would take all night for me to go through every pathway and every receptor. But these two main receptors that I want you to know about, CB1 and CB2, have targeted organs and responses that it's trying to put back in balance. So for example, CB1 receptors targets the immune cells. It targets areas that regulate and modulate your appetite, your motor activity, your pain perception, your thinking, your memory. Whereas CB2 receptors, they target organs like your cardiovascular system, your heart, your bone, your adipose tissue. Yeah, you're fat. I said it, you're fat. That's why CBD helps us to lose weight, because the endocannabinoid system has receptors in every single organ and gland to help us to be into balance, to reduce stress, to reduce inflammation, to reduce muscle spasms, to help us sleep. So when we talk about so many Americans that are looking for CBD products, and so many Americans, so many of our friends, so many of our patients are looking for another tool in the toolbox because they may be on medications, it's important as healthcare professionals that we understand how CBD is metabolized. Why is that important? Well, there are potentially some drug-drug interactions. So there are some medications that can act when you consume CBD to make that medication work more efficiently. And there are some medications that you may consume with CBD that may reduce the effectiveness of that medication. So it's not that your patient can't take CBD. It just means that, one, if that patient is, for instance, on Coumadin or warfarin, which is a blood thinner, that patient may need more careful monitoring of their blood. That's all it means. And also, we want to ensure that you as healthcare professionals understand when your patient is taking CBD, or maybe you're not a healthcare professional. You want your doctor, your nurse practitioner, your chiropractor, your dentist, your pharmacist to know you're taking CBD so that you can remember to, one, space out when you take your CBD about an hour to 2 hours apart, but also alert your physician or healthcare provider that, yeah, when your blood pressure starts to improve, they know where credit is due. So yes, CBD can negatively interact with other drugs, but those drugs, again, those medications that you may be on, you need to monitor those blood levels. Now, when it comes to CBD showing up on a drug test, this is a real concern, right? Your patient may be a pilot or a stewardess or a police officer or a parole officer or maybe even a doctor or nurse, and they may have truck driver. They may undergo a random drug screens. So it's important that you understand that one, topical products do not pass the blood-brain barrier. So topical products will not cause a urine drug screen to be positive, okay? The other thing that's important to understand is that there are full spectrum and there are broad spectrum products. So there are products that are specifically formulated for those who have urine drug screens, and we have those products here at Wakana. Those are our broad spectrum products that contain less than 0.0% of THC. Now, when I looked at the research, when I looked at the data absolutely shows that even if a person took large amounts of a full spectrum product, yes, it would show up in their urine drug screen around 11 to 20%, 23% of the time. And that's at doses of like 1,000 to 2,000 milligrams a day. That's a lot of CBD. So to avoid that, there are products that those who have urine drug screens can take. They are called broad spectrum products. So the urine drug screen that you find at your local pharmacy, CVS, Walgreens, these urine drug screens are not very sensitive or specific. They're called point of care, meaning, you don't go to a real lab. You just go home, urinate, put the dipstick on there, and test for THC. So if you are on the line, if you're a healthcare professional, just know that LabCorp has a very sensitive and specific urine drug screen that you want your employees, that you want your employer to perform on you. You don't want your employer to do these little point of care, over the counter urine drug screens. They're not very sensitive and not very specific, meaning that this point of care, the ones you get from Walgreens or CVS, they don't know the difference between CBD, THC, Delta 8. All they know is that they see a cannabinoid and they're going to say positive, and you don't want to lose your job, right? So you don't want to use these point of care urine drug screens that are found at Walgreens or CVS when you're dealing with the possibility of losing your employment. LabCorp has a very sensitive and specific urine drug screen. So some things that you should know, some things you want to share with your patients before buying a hemp-derived CBD oil, a CBD product. Well, first of all, you want to recommend Wakana products because we are the crown jewel CBD. We have very high quality products. Our products are tested. Our products are sourced from organic farms, right? You also, because not all CBD is made equally. Let's get that right out of the gate. Let's get that confirmed. Not all CBD is made equally. There are CBD products that you absolutely can find at the gas station, at the health food store, at the grocery store that are not really CBD. A lot of these products are hemp seed oil, and hemp seed, the seed of the hemp plant, does not contain CBD. We get the CBD from the flower and the bud of the hemp plant. So knowing how the hemp is grown, knowing how the hemp is extracted, making sure that there is testing by a third party, and understanding that Wakana is the crown jewel of CBD. We offer very unique and very high quality products. So when we talk about the difference again with the plant and the way it grows, just know the hemp plant takes about 108 to 120 days in its growth cycle. Understand that CBD that's sourced from hemp, I can't stress it enough, will not give you a high. It will give you the health without the high, okay? So that is a slide we've already talked about, that our products are grown organically. Hemp is a bioaccumulator, meaning that when you grow hemp, it will accumulate whatever is in the soil. So if you have pesticides, if you have heavy metals, if you have mold, fungus in the soil, guess what? That will be in your product. So it's important to understand that our products are grown organically. Our products are sourced from farms in Oregon and Colorado, and this is really, really important. Our products are extracted by a very clean extraction method. It's called supercritical CO2 extraction method. There's all sorts of ways of extracting hemp from the biomass, or CBD products from the biomass. There's butane, there's propane, there's alcohol. There's all sorts of ways, but supercritical CO2 extraction method is very clean. Yes, it's a little bit more expensive, but it really does produce a high quality product. And then there is third-party testing, certificates of analysis. Our products all have certificates of analysis. This is crucial. This is crucial in this industry, and it's crucial in this day and age. Why? Think about it. Let's say you want to give your patient or your grandmother or your great aunt, or it doesn't even have to be someone old, someone that may have an immunocompromised condition. Maybe they have cancer, or maybe they have an autoimmune condition, or maybe they're HIV/AIDS positive. That person taking a product that has heavy metals, pesticides, mold, fungus, could potentially cause a very big threat to their health. So third-party validation, certificates of analysis are critical. So we offer this with all of our patients, testing the potency, testing the mold, mildew, heavy metals, pesticides, residual solvents, terpenes, you name it. And our certificates of analysis are really easy to read. Our one-pagers are just pass, fail, so that you can easily interpret what's in the product. So let's talk about the different ways that one can consume CBD. There's oral applications or tinctures, there's vape pens, there's smokables, there are pre-rolls, there's water solubles or liquids, there's edibles like gummies and spices and butters. There's capsules like our Power King T'Chaga, which utilizes CBD and mushrooms. And then there's topicals. So it just depends on your preference of consuming CBD, but I always recommend to healthcare professionals that when your patients are utilizing our products, that you recommend more than one, that you layer these products, that you utilize the tincture, the topical, and the gummy, because as one is being metabolized and getting into the bloodstream, one is already working. So you have a steady state of CBD in your bloodstream. That's called layering, where we're utilizing different ways of consuming. So there's always that CBD working in the bloodstream. So let's quickly talk about some of our products here at WAKANA. First, a disclaimer that these statements have not been approved by the FDA. If you are under a doctor's care, if you're on medication, if you're pregnant, nursing, please consult with your physician before utilizing these products. So our products are safe and effective. There is the disclaimer. I've already read it, but you need to see it. Super important to stay in compliance with the FDA. But we have products that are suggested and recommended for those who have random drug screens. And then we have other products for those who don't have random drug screens. And that's what I love about our product line. No one is left out. So our power line, those are the products that are in the black label and they have the word power. Whenever you see the word power, that means that that product contains the legal limit of THC. Whenever you see the word pure or white label, those are broad spectrum products. Those are products that contain less than 0.0% of THC. And that's super important that your clients, your patients, maybe you on the line that may have random drug screens, yes, you can still utilize our products. So tinctures are products that you place underneath the tongue. You hold it underneath the tongue for a minute before you swallow. This is super important so that the glands underneath the tongue can absorb the tincture and it can get into the bloodstream. Tinctures take about 15 to 20 minutes to get into the bloodstream. So that is why we recommend that you, one, hold it for a minute before you swallow so you can really get the effect and the bioavailability to the cells that we are looking for you to get. So the recommended dosing of tinctures, really easy, 3 drops twice a day. You want to start out with 3 drops twice a day. Yes, that's a very low dose, but you want to start low and slow. You never want to introduce a lot of CBD all at one time, all too quickly. What does that do? Well, potentially it could cause a side effect. It could cause some extreme fatigue. It could cause some nausea. It could cause a headache. So we don't want you to have a bad experience or your patients to have a bad experience. So start low and start slow. So those are the tinctures. We also have a power product that's a water soluble. I put it in my water. I put it in my juice, my fresh juice that I make in the mornings. I put it in smoothies. You can put it in anything liquid, as well as those who have cognitive functions like dementia. This is the perfect product for them. Those who really can't really understand holding a tincture under their tongue. And then we have another product, which is more of a therapeutic grade of product. It's called our Hemp MD. It's really for those who have more of a severe challenge that they're trying to address. This product is 900 milligrams of CBD. It's one of our most potent products in our product line. So another feature I want to bring out about our products is that our products are unique. Our products, we formulate with a proprietary formula, which utilizes a lot of essential oils like black seed and turmeric that increase or enhance the effectiveness of CBD. So many of our products have a proprietary formula where we've utilized essential oils to increase and to enhance the effect of CBD. Our topicals offer local relief. And again, remember, our topicals, many of them say the word power, but because they are topical, they do not pass the blood-brain barrier and can be safely used for those who have random drug screens. So our topicals, yes, they will assist and address those folks who have inflammation, who have pain. We have topicals that are in a salve form, our Extreme Power Relief, our #1 seller here at Wakana. And then we have our liquid relief, our Dr. Rita's Rub. Again, many of these products can even address your skin, your face. We have a Holy Glow facial serum, a mask, a moisturizer, all utilizing the science behind the endocannabinoid system. We have edibles, we have gummies, we have products that, again, can be utilized for those who have random drug screens, our pure products. We have power products, those who do not have random drug screens. We have a flat belly brew, which is a broad spectrum product. We have flat belly gummies, which is a flat belly broad spectrum product. We have gummies that address libido and improving stamina and sexual enhancement. We have products that really address the immune, boosting the immune system, and just improving your overall health. Our essential oils are all organic. Our black seed, our frankincense, our eucalyptus, our peppermint. And our First Defense utilizes a proprietary formula which utilizes CBD and essential oils that can be applied in the nasal cavity, that cavity where so many viruses and bacteria enter our body. Our smokables. Now, currently we have one smokable, our Delta 8 pre-roll, but smokables act very quickly. Within 1 to 5 minutes of using one to 3 puffs can really help you to reduce the cravings for nicotine. Maybe you're out there and you're a smoker, or maybe you want your patients to stop smoking, or maybe you have anxiety, and maybe you have acute flares of migraine or gout. Smokables work quickly. Smokables work within 1 to 5 minutes to really address your challenges. We talk about the chefs out there. We have culinary products. We have spices. We have our garlic fire, our flavor king, our chili lime, our vegan butter, our culinary plus. All of these products can be utilized in the kitchen to enhance your favorite recipe, and again, to put the body into balance. We have a Save Our Strand hair care system. The skin is the largest organ on the body. So please don't negate that skin on the top of your head called the scalp. The scalp needs to be very healthy. If the scalp isn't healthy, then the hair follicle is not able to be healthy. Our hair is not healthy. So our hair care system utilizes CBD along with essential oils, again, a proprietary formula that really helps to improve the health of our hair. We've even thought about your office, your home, your produce, your meat. All of these things need to be safe. All of our environments need to be safe during this global pandemic. So yes, we have a sister company called Royal Defense, where we offer hand and surface sanitizer, produce wash, and mask as well. Sexual health. We have a very exciting holiday coming up. It's called, you guessed it, Valentine's Day. So we have sexual enhancement products that are utilizing CBD that will enhance your sex life. These products, again, being topical, will not pass the blood-brain barrier, so they can be safely used if you have random drug screens. So we have a CBD lube that help to lubricate the vagina. We have the KOJ gummies to help to improve stamina and libido. We have body butters utilizing CBD and hibiscus and lotus. We have an amazing lineup of products. So there are so many great choices. You can't go wrong. Hopefully, if you're on the line, you have a better understanding of how important it is for healthcare professionals to get this knowledge, to get the understanding that there is a difference between marijuana and hemp CBD, that there is a science behind how cannabis works in our body, the endocannabinoid system, and how important it is to partner with Wakana and Wakana's products to ensure that you have a safe, effective, and tested product in your body. So that's all for me. Oh, I forgot to share one thing. Let me go back. I forgot to share one thing. And that one thing is my email address. My email address is listed here, ritamd@wakana.com. So if you have questions, suggestions, comments, and or critiques, I welcome that. You can email me, give me between an hour or two to get back to you. I'm always looking at my emails constantly all day. That is my information. If you're on the line and you want to hear more about the opportunity, you want to hear more about our products, you want to hear more about our founders, you want to hear more about our Wakana community, tune in at 8 o'clock, which is in 15 minutes. Tune in at 8 o'clock. That's the Zoom ID and passcode. And join our team. We do a Wakana business overview. So I'm going to stop sharing. And if you have a question or two, I will take any questions. Thank you, Ma Mitchell. Thank you so much. Ma Mitchell says, I use CBD for diabetes. She uses CBD to relax, for her skin, for pain, and for her hair. Yes, absolutely. CBD has been found to reduce inflammation. CBD has been found in the literature to rebuild beta cells in the pancreas. It also helps to cause vasorelaxation of the blood vessels, feeding the pancreas, feeding the heart. So yes, CBD can assist in so many challenges that you may have, your family may have, or even your patients if you are a healthcare professional. Now, let me just take a poll. Are there any healthcare professionals on the line? If you are, you can put it in the chat. Let me know. If not, that's okay. But what I would ask of you, Dr. Rita doesn't ask of much, but if you could get your healthcare professional on the line next Tuesday. Next Tuesday, 7 p.m. I'm pretty sure we're going to have and be blessed with Dr. Kim next Tuesday. I'm excited to let you all know that my daughter has been accepted to medical school. So next Tuesday night, we're kind of taking her out for a little celebration. So I will not be here, but Dr. Kim will. I just love my medical advisory board. They're always chipping in. They're always providing knowledge and imparting it on all of you. So get your healthcare professionals on the line. Let them know 7 o'clock every Tuesday we are here. So if there are no other questions, I will let each and every one of you go. Thank you for attending. My business partners, thank you so much. Hopefully you learn something new each and every time that you listen to presentations. Hopefully you take little nuggets away and share them with your team, with your clients, with your customers. But we will see you in about 15 minutes on the Wakana Business Overview. Be well, be safe. God bless you all, and I'll see you soon.